It is an extremely special feature called the Annual Day Oration. So this is the 8th IPH Bengaluru Annual Day Oration 2025. It's a tradition that brings wisdom, perspective, and inspiration to the forefront of the celebrations that you and I have been witnessing. This oration series is IPH's flagship platform to host distinguished voices in public health, individuals whose work and journeys have inspired transformative change across India and beyond. It started in 2018. The oration has grown into a meaningful tradition featuring speakers who have shaped the public health landscape. So to give you a sense, let me tell you, for the 2024 oration, this platform had the honor of hosting Dr. Soumya Swaminathan, former chief scientist at the WHO and now chair of the MS Swaminathan Research Foundation. ಈ ವರ್ಷ ಅಂದ್ರೆ ಈ 8ನೇ ಸಂಕಲನದಲ್ಲಿ we are honored to welcome a bureaucrat, an officer with impeccable record and whose work is much admired, Ms. Uma Mahadevan as our orator. I now invite Dr. Tanya Seshadri to introduce Uma Mahadevan Auru.
Thank you so much. Good evening, everyone. It is my privilege to introduce to all of you our Additional Chief Secretary to Government of Karnataka, Ms. Uma Mahadevan Dasgupta. Her path to civil services was both personal and pioneering, being the first in her family to head in this direction, encouraged by parents who saw in her the potential for societal change. Yes, ma'am, we have to embarrass you a little. She often recalls a childhood memory of her mother comforting a woman who used to come to work in their home covered with bruises from domestic violence. And in fact, she has often said that it was her mother's words that if we want to help such women, then the only way is through the system. And this left a lasting mark on her sense of purpose. Ma'am joined the IAS in 1992, and her early work was rooted in the realities of the villages and towns of Karnataka, from restoring a heritage pond in Madhugiri to learning from cultural stalwarts in Sagar. She has led pioneering efforts in rural development, skill development, women and child welfare, and Panchayati Raj as well. Under her leadership, rural libraries and digital access have reached lakhs of children. Thousands of women have found dignified livelihoods, and thousands of youth have benefited from the skill development programs. She was instrumental in preparing Karnataka's first human development report and was also part of the National Task Force for Early Childhood Care and Education. What drives all this for her? Well, it's her conviction that policy must always return to the ground, to the people whose lives we seek to change. As one of the most respected leaders, women leaders, senior women leaders in civil services today, she shows us all how governance, when led by empathy and courage, can truly transform lives. Please join me in welcoming Ms. Uma Mahadevan Dasgupta for the annual oration. Welcome, ma'am.
Thank you, Dr. Tanya, for that lovely introduction. Certainly not from the brief bio that I usually share. And thank you also, Vasanthi Hariprakash, for that lovely introduction. Thank you, Vasanthi. It's a very great pleasure to deliver the IPH Annual Day Oration. That was a huge build-up, by the way. I am not sure if I'm going to be as good as the panel that I just heard. The panel that I just heard, as well as the questions from the audience, were amazing and insightful, and I could have gone on. I was just telling Dr. Prashant that you could have dropped mine and I could have comfortably sat there and listened because it was so interesting. But it's a great pleasure and an honor to deliver the IPH Annual Day Oration on the occasion of the 20th year of the Institute of Public Health, Bangalore. Over these 2 decades, IPH has played a key role in strengthening health systems in our state, working to advance health equity and inspiring change. It's been a journey of commitment, innovation, and impact on the ground. Thank you so much to have given me an opportunity to be part of this wonderful celebration. I can see that you've had a packed schedule today with some stellar speakers and panelists. I'm sorry I couldn't make it to listen to the panels and speeches. I had wanted to, but today was a little milestone in my own career. I handed over charge of Panchayati Raj after 6.5 years. I've moved on. I'm now continuing as Additional Chief Secretary and Development Commissioner. But I'll try to keep my reflections informal rather than I have a prepared speech, but what I'd really like is to share some glimpses of what have been some of the moments in my work, as well as what we can do together in public service. I'd also like to touch upon some of the questions that I heard, questions about scale, questions about policy versus implementation, why we seem to be so good at policy, drafting policy, but where do we go wrong in implementation, why we seem to lose track of equity when we're talking about equality, why decentralization is important. It's in the topic that I chose for my talk. Why also I think some of the answers are in looking at people and communities, not at the last mile, which is a metaphor from telecommunications that's increasingly popular these days, but really the first mile, because everybody deserves to be regarded with all their needs, their context, their aspirations at the first mile. And it's only the local government which is really in a position to do that. But before everything else, ಒಂದು ವಿಷಯ ನಾನು ಹೇಳಲಿಕ್ಕೆ ಇಷ್ಟಪಡ್ತೀನಿ. ತಾವು ತ್ಯಾಗದ ಬಗ್ಗೆ ಮಾತಾಡಿದ್ದೀರಾ, ತ್ಯಾಗ, ಸ್ಯಾಕ್ರಿಫೈಸ್ ಈ ಬಗ್ಗೆ. ಆವಾಗ ನಾನು ಯೋಚನೆ ಮಾಡಿದೆ, ಇಟ್ಸ್ ಟು ಮೀ ಪಬ್ಲಿಕ್ ಸರ್ವಿಸ್ ಹ್ಯಾಸ್ ರಿಯಲಿ ಬಿನ್ ಅ ಜರ್ನಿ more evocative of Tagore's words. I always think of Rabindranath Tagore's words, who said, I slept and dreamt that life was joy. I woke and found that life was service. I acted and found that service was joy. And that's been, I think, the most rewarding part of work for all of us who are working on the ground, that, being able to serve and being able to do something to bring change in a context that needs so much change, needs so much improvement, where there's so much to be done, is a rare opportunity, and it's something that we should all cherish and really be proud of. So I'd like to start with this picture, which is from the COVID days. This is actually a picture of a Gram Panchayat. This is, I think, is it Bagalkot? Yeah, it's in Bagalkot, Mudhol Taluk. And this is Chinchkhandi Gram Panchayat in COVID, in the COVID pandemic. COVID came upon us very quickly, and we had to mobilize all our resources. In March 2020, I still remember, we issued a 10-page circular. In the end of March 2020, we issued a 10-page circular saying that since the lockdown is coming, it's already imposed, we can't come to the rural areas, officers and experts can't come to travel, and therefore what we do will have to be done remotely on YouTube Live. And so we set up these Gram Panchayat task forces. Karnataka is, just to give you a bit of history, Karnataka is a pioneer in decentralization. In a country which has much more to do in decentralization. And thanks for that. That's very helpful. So Karnataka had its first experience in legislation for decentralization as early as the 1980s, when among many, many radical changes, the very first experiment of bringing 25% reservations in seats for women, it was the largest experiment of its kind anywhere in the world, happened in the 1980s in Karnataka. And since then, we have had the constitutional amendment, for which Karnataka's legislation was one of the templates. We have had 6 rounds of elections after the constitutional amendment. We've had 6 rounds of Gram Panchayat elected local bodies. And therefore, in 2020, when COVID came upon us, as silently as it did, we had in Karnataka nearly 6,000 elected local bodies on the ground, with nearly 90,000 local elected representatives, 50,000 of whom were women, and another 40 to 50,000 local officials, field officials of the panchayats, who were ready and eager and willing to be told what to do and guided with science-based information. So what we did was we issued the circular, and we didn't even have the usual services to send out the circulars in print. So what we did was emailed and WhatsApped. We used WhatsApp a lot. I remember in the initial days, we were just working out of 2 mobile phones, each of us, WhatsApping from these phones. But we issued the circular, and we asked all the Gram Panchayats to sit in front. We created a task force. Now, if you can see this task force here, it's not only the elected officials, it's not only the elected president and vice president and the members, it's also the panchayat officials, and it's also the ashas, the Anganwadi workers, the field community workers, the village rehabilitation workers. All of them formed part of the Gram Panchayat task force. And this was an experiment. We had no clue whether it would work, whether it was going to make any impact on the ground, or whether people would panic, nothing. But all we said was, tomorrow morning, we're going to do a YouTube training. Please sit in front of your computers at 11 o'clock and sign in on the YouTube live chat. Well, it was quite miraculous. 10:45, we opened the chat, and it was like a flood. Panchayats were already sitting in front of their computers. They were sitting there and waiting to be told what was this new thing, what was corona. It wasn't even called COVID at the time. We were drawing slides from Ministry of Health and WHO and so on and so forth. But long story short, these task forces across nearly 6,000 Gram Panchayats, local bodies in rural Karnataka, mobilized to work together to convey science-based awareness, which prevented stigmatization, prevented panic, gave people ways to contend with what was a very frightening thing for all of us, gave people ways to deal with information asymmetry. They took our PPTs and they took those big pictures of the coronavirus and they converted it into wall art and rangoli art on the streets and said that you need to be careful. They took our instructions that you should not have people sitting together, you should have physical distancing, and you shouldn't have people sitting together and chatting where they can catch the infection. And what they did was, there are these kattes in every village, and they applied sticky oil to the kattes so that people would not gather there, and various kinds of things. But they also went house to house, along with ashas, along with Anganwadi workers, to more than 1 crore households, in order to visit and understand what could be the comorbidities that could affect people in different ways, whether there were any pregnant women who needed attention, different kinds of things. And that was when we also saw a very interesting movement between a welfare-based approach to something that was looking more and more like care. And that was very exciting for us. This is one of the pictures, going house to house, literally to every single house. Because this was one of the first experiences where communities worked as communities. Because they realized that we're all in it together, and we all have to help each other. And that was a tremendous learning, but they crossed that learning curve so quickly. Some very beautiful pictures, blurry pictures coming to us as feedback from the ground. COVID vaccination. This was another tremendously exciting phase, because somebody will have to stop me 10 minutes before it's time, because I could go on. COVID vaccination, because this was again a complex thing. People needed phones, smartphones, to register. And many people don't have phones. Not everybody has a phone. And then every phone could only take 5 numbers. And then there was 1 dose, and then after some time there was a booster dose. And then you had to download the certificates so that people would have it. And apart from all the logistics of the process, people were really scared. People who had taken vaccinations as little babies and children were not used to taking injections as older people. There were Anganwadi workers who were actually holding the hands of elderly people who were shivering. And there were panchayat members who were sitting and taking the vaccination first so that they would give confidence to others. All this happened. These are pictures of our health workers, community health workers, literally in the field, vaccinating people wherever they were. And we have, I just had to pick up the first pictures that I saw. But we have so many umpteen instances on the ground. Unfortunately, there hasn't been a massive documentation of all this because we were all just, working at a pace that we've never really done before. But this was, I think, also a time of learning for us about how decentralization and empowering local bodies with oversight and with involvement and with convergent decision-making on the ground can actually improve our service delivery units. Whether it is Anganwadis, whether it is primary health centers, sub-centers, whether it's vaccination. Vaccination was a massive exercise, massive exercise. They were actually, initially, before we had the mobile vaccination happening, they were actually transporting senior citizens and persons with disabilities in vehicles that the panchayats were organizing, transporting them to the primary health center because there was this whole worry about adverse events and so on. And therefore, all the vaccinations were given in facilities. So all of this is very complex stuff. And it's not easy to do it in a vertically managed system. Therefore, it's very important for communities, through their locally elected governance structures, to actually take this into their hands, which we saw in the second phase of the pandemic. In the second phase of the pandemic, actually, the Chief Minister of Karnataka had a video conference with various panchayat presidents. And for the very first time, a state disaster relief fund was sanctioned directly to panchayats. Because the panchayat has to be, the local body has to be the first port of call. Panchayats conducted isolation centers. I think they set up around 6,000 isolation centers in schools. And because they didn't, for the mild cases, and because they didn't want people slipping off home at night, they ensured that there was good food. They also ensured that there was good entertainment. In the gardens, they would actually, and we had some panchayat members who performed and sang songs. Shushanala Sharif was performed. So various kinds of things. But the fact was that what we were seeing was actually a way in which welfare can actually move to a paradigm of care. And that's why I think these questions that we ask ourselves about state capacity, about why we're a flailing state, why we make great policy, but on the ground we're implementing badly, about premature load bearing, all of these things. Actually, the answer really is, a part of the answer is in more decentralization, better empowerment of local bodies. Some of the most complex questions, such as child stunting, quality of learning, child marriage, women's labor force participation. Some of the answers to all of these are actually in decentralizing more, allowing, and countries as different as the USA and China have realized this, and they decentralize a lot more. So this on the picture on the right is actually a woman driving a solid waste management vehicle. And this is an SAG woman who has been trained as part of our work 3 years ago, trained, given a driving license. And so this again is an example of how waste management, and I'd like to take it back to the question of caste. Before we involved and asked SAG women to do this end to end, we found that only the dirtiest work of segregating mixed waste was being done by the poorest women from oppressed castes who had no other option of a livelihood. So we said, we'll change this. We will ask SAG women's groups to do end-to-end solid waste management, including the fancier work or the more empowered work of driving the vehicles, of collecting the user fees, of picking up the waste, of doing the behavior change communication, of becoming influencers, of selling the waste, right? And of also refusing to pick up any mixed waste that was not segregated at source. So this is an example of that. So I have a slide about decentralization reasons, the principle of subsidiarity. I don't think I need to say much about this to this audience, so I'll skip this. But I will say that the COVID experience really taught us that this whole thing of the last mile is not where the panchayats are at. They see the citizen at the first mile. They are not seeing the citizen in terms of aggregates, but as individuals. They are also able to act convergently. It's a truism to say that health works in silos and women and child works in silos and education works. Of course, we work in silos because we're a very large country, we're a very large state. It's really impractical and impossible to work convergently at a very high altitude level. However, at the panchayat level, you don't have a member for health. You don't have a member for education. You don't have a member for nutrition. They're all members of the panchayat. They're local elected representatives. From birth to death, they are there to care for their communities. And so you can have convergence. Panchayats also had untied funds. Just one example is that we had a lot of people coming in from urban areas to rural areas because in March 2020, it was the Ugadi festival, which is a big festival in Karnataka. A lot of people had already gone home and they were stuck there because of the lockdown. So we had urban women and girls who were used to using sanitary napkins in their urban settings, who didn't have access to it in the rural areas, but the panchayats actually organized it and procured it and distributed it to the women. So these were the kinds of, this is what I say, that when you see people at the first mile, you're actually solving problems. And similarly, the problem of exclusion. If there's somebody living in a tanda, somebody living in a hut, somebody living outside, somebody living remotely, and they're excluded, they've been left out of the vaccination, they're left out of the conversation, this is where the panchayat can play a role. And of course, participation and deliberation, which I don't need to tell you. But one example I'd like to share is actually evidence, because along with anecdotes, I wanted to share a bit of evidence. Here is one example of secondary data of MG-NREGA, which is the Employment Guarantee Scheme of Karnataka, of India. The data of Karnataka showed that elected gram panchayats, we had about 150 gram panchayats out of 6,000, which were on a different election cycle, and therefore they had administrators. But the elected gram panchayats generated 15% more person days. That's what the researchers, Bijura of the World Bank and Sharon of Maryland and so on, used Karnataka's data and said that this is the added value of local democracy, if you want to quantify it, right? So responsiveness. Having said that, there are, the usual biases, more men, more upper castes, other advantaged social groups, and yet you have 15% more person days. In Karnataka, we generated a record number of 16 crore person days during 2021. Because people were in rural areas, they needed the money, they needed the livelihood. This was the only livelihood opportunity. This is a picture of women workers in NREGA. I use a lot of pictures in my slides because it doesn't take time. It shows you a glimpse of our work. There's also data from Darjeeling and Sikkim about NREGA again, being used for disaster risk reduction. It's a lot of data, but says the same thing, that Darjeeling has an administrator led area, and Sikkim has local panchayats. They use MG-NREGA in a way to improve outcomes in the same landslide-prone areas. Another example of Karnataka is the Gram Panchayat libraries. So we had vertically managed 5,600 libraries, a network of 5,600 libraries, which were transferred as an exercise in decentralization in 2019. They were vertically managed, they were a little dormant, they were kind of forgotten, they were not really active. But during the COVID pandemic, what we saw was that because we had one of the longest school and college closures, we found panchayats eager to reopen, and not only reopen the libraries, but also revive them. So what we did was, we helped them from the department. We didn't spend a single rupee. It was all the panchayats who spent their money. But what we did was we helped them with guidelines and said that you need to take 4 steps. One is all rural children will be enrolled free of cost as library members up to the age of 18. All libraries will have a children's section, including picture books. All libraries will have both print books as well as digital resources, including computers. Not a single library had computers at that time. And all libraries will be revived, renovated, new buildings, new paint, whatever it is. 5 years later, 4.5 years later, we have 5 million children enrolled free of cost. We have libraries functioning as community spaces for information, interaction, inclusion. Communities are rediscovering libraries as kind of living rooms of the community, adding chessboards, adding carom boards, adding TV screens. They watch the election results in the libraries. And we're setting up 6,500 new village libraries. I'll show you a couple of pictures. So this is what a library looks like now. We have 6,000 of these, nearly 6,000 of these, 5,900, and we are setting up 6,600 more. During COVID, the libraries functioned for 4 hours a day. This was the only thing that we managed to increase working hours and increase the remuneration of the librarians in the department during COVID to 6 hours a day, increase the remuneration, and now libraries function for 8 hours a day, including Saturdays. We have, as I said, 50 lakh children who are enrolled. We also have senior citizens coming in the mornings, we have health camps, we have different kinds of activities. Libraries are really turning out, blossoming as community spaces. And this is again an example of what happens when service delivery units get given to local oversight, local ownership. From the department, we did not say that you have to paint it this particular shade of green or yellow or blue. We left it to them. All we said was you should have at least 2 computers in your libraries. Some libraries, some panchayats added 10 computers and found that all 10 were occupied, right? So this is how the program improved and grew beyond our expectations. So much so that Saturdays and Sundays, fathers of young girls walk with their children to the library to help them borrow books. Grandparents come along to watch their grandchildren use the computers that possibly the grandparents have never been able to use. And this has really grown into something beyond our expectations. Similar is the case with Anganwadis. Karnataka has a network of 70,000 Anganwadis. Even as we speak, we are in the 50th year of the ICDS scheme in India. And October 2nd, 1975 was when Karnataka also was part of the rollout of the first ICDS projects in India. Today we have 70,000 Anganwadis in Karnataka, one of the most complex programs. Vertically managed, very difficult to do. Anganwadi workers, helpers, training, food, cooked food, hot cooked food, toilets, ensuring pregnant women get their antenatal checkups, children get their immunizations, early childhood education, all of that. Local oversight, this is what happens. Field trips, Anganwadi field trips, nature education, lots of local materials. Milk. Of course, it's not that the State Department doesn't help. Of course, the milk program is one of Karnataka's most successful programs, puts money in the hands of women farmers, but also puts milk in the hands of, a glass of milk a day, in the hands of about 1 crore children every day in Karnataka. Also, our frontline workers, our Anganwadi workers, helpers, massive resource on the ground, whom we supported with labor-saving devices during the rollout. Some of the pictures from the Anganwadi program. Also, new areas of work. As I already said, solid waste management. Here is a woman driving with encouragement from the Panchayat Development Officer who's sitting next to her. and both of them are having a great time going for their very first ride in the solid waste management vehicle. We also have public transport. We saw mobility as an enabler. Again, panchayats started asking for more bus routes, more participation from women. This is an elderly woman getting into the bus and thanking the government because she didn't have to ask her children for money every time. And that's a really important issue. It's a really big enabler, and it provides self-respect for women. This is a new program that we started. I'm pretty much abandoning my prepared speech because I think I'll just stick to this. But this is a new program that we started when we realized, as I was in the ECC task force, and we realized that one of the things we haven't solved in the ICDS program is what to do with children who are under the age of 3. And so we said, what if we tried to do a convergence with MG Narega, which pays for the wages of creche caregivers, and Panchayat provides the space, and Mobile Creches, who's our training partner, does the training. So we started 4,000 rural childcare centers. 3,900 of these are functioning right now. And what I like to see, this is the creche committee, what I like to see is that there are also fathers coming in to check on their children. This is the inside of one of the creches. Women's entrepreneurship, another part of things that panchayats, local bodies have been able to help us with. Self-help group women. Women's entrepreneurship, again, is an answer to countries like India, where labor force participation in the formal employment sector has its limitations, but women entrepreneurs will recruit other women. They will hire other women. They will have a value chain where women are supplying goods. And so women's entrepreneurship, again, this is in a Taluk Panchayat in Devanhalli, where we started. New skills. So again, in local bodies, we have started training self-help group women in basic plumbing, multi-skill training, fitting, masonry. Nobody thought this could happen, but when you start showing that this can happen, it says a lot more than innumerable papers, because in the civil service, we often don't know how to read or read papers or analyze them or have access to them, but actual work on the ground really speaks for itself to us, and new skills leading to new avenues. These are women who were trained in the Bangalore Rural Zilla Panchayat, now working for Indigo as ground drivers in the airport. These are women who are actually solid waste management staff, elderly women working in segregation. But now this is where it becomes intersectional and even more beautiful, because these women said, what are you doing in libraries? Can we also learn? And then one of our Panchayat Raj fellows helped them to start learning. So they're learning from each other and from their daughters and granddaughters. So this is how things actually become more comprehensive. Rooms of their own. We're now trying to give self-help group women rooms of their own so that they don't have to have their meetings in the homes of presidents and vice presidents and so on, where some women sit on the ground, some women sit on chairs, but they get to meet. But I think also, coming back to the question of health and where we can work together, as we did during the COVID pandemic, IPH worked very closely with us. The basics. We still have so much to do on the basics. If you look at this picture, this is from a hot meal program. Shalini, you'll remember, this is Matrupurna. This is from Yadgir. This woman is a construction worker. She has this little toddler with her. The toddler is not Anganwadi age. So if the hot meal program hadn't been started, the toddler would not be coming to the Anganwadi. But there's also a little baby, a newborn or a few months old, in the mother's lap. So this hot meal actually was rolled out for 800,000 women with a very well-planned diet, which included egg, milk, lentils, and so on. Women's health, again, antenatal checkups, getting women their care before and after pregnancy and not treating them as vehicles to produce babies. This is, again, in an Anganwadi, weighing machines. Women's collectives. So this was one of the other things. We never expected this. When we started the hot meal program, we saw that there's so much bias against women eating, that there's so much superstition attached to it that they would be facing the wall. In the first week, they were all facing the wall and not facing each other and eating. But within a week, they felt so foolish and started laughing about it. And then they started sitting together, walking to the Anganwadi together, and overcame that initial feeling of hesitancy. Again, creating collectives. Girls' education, areas where we have much more to do in terms of GER, in terms of retaining girls, in terms of empowering girls to go beyond higher secondary. This is a girl in the library, by the way. It's one of our libraries, one of our earliest library pictures. Visual representation. Again, so someone was asking about scale. Scale is important because the numbers. I mean, we have to do so much for so much. But also quality. And therefore, we need to constantly balance between the details, which is why I always like to see the different creative ways in which panchayats have, so here's equity, right? There's a boy and there's a girl, and they're reading. And nobody had to tell them that this is how you do it. It was just natural. Whereas we talk so much about gender representation in textbooks and this and that and all that. But here, all of that has paid off because they've naturally just done it. Also inclusion, because I think panchayats have started realizing that deprivation is intersectional, and therefore all sorts of accessibility devices, computers with screen readers, Sugamya Pustakalaya, this little child is sitting in a rural panchayat near the banks of the Kaveri in Ramnagar, listening to a story. She's visually impaired, but she's able to come to the library and read. We're also using Alexa and digital voice assistants in very interesting ways in the panchayat libraries. Safe spaces. So again, local bodies are able to, I'll just take 2 more minutes. Safe spaces. Local bodies in Karnataka, ever since 2006, have been conducting children's Gram Sabhas. So some of them do it in a perfunctory way, but many of them, I would say most of them, do it in ways that are extraordinary. So here is a Gram Sabha. So Gram Sabhas are actually assemblies. Assemblies of everybody in the village to take decisions together. But children's Gram Sabhas are where children are able to raise issues that are of concern to them. So this is a picture taken with permission of the girl who's standing is actually talking about her family is pressurizing her into a child marriage. And I haven't zoomed in, but if you do zoom in, you'll see that her face is extremely full of pain and expresses the kind of stress that she's going through. So obviously, the team immediately responded and spoke to the family and all of that. But if you see the picture, you can see the other girls. They don't think it's funny. They know that it's real. It's very real. It's part of their lives. And they're waiting to see how the authorities will respond. What I also found special was that this child found that this Gram Sabha was a safe enough space for her to actually say this. And that was incredibly moving. So this is what can happen when we engage communities through their governance structures at the first mile. And of course, this is my last slide. This is from a library. This mural has been painted by a panchayat on its own. If you see, it's not, so we worry so much about being literal minded, but this is a beautiful metaphor. She's got a book in her hand, but she's dreaming. She's not literally sitting there and reading. She's dreaming. And I think it's not just about girls, but of course, letting girls dream is an important part of what we should do. I think at the first mile, all of these magical things can happen if we can engage our communities and continue to work with them with a sense of humility and equality and a sense of service. Thank you so much once again.